Budesonide-Formoterol, a powerful combination medication, holds the key to effective respiratory management. In this comprehensive guide, we delve into the multitude of uses, optimal dosages, and essential safety precautions associated with this innovative treatment. Designed to treat and prevent respiratory symptoms in patients with asthma and chronic obstructive pulmonary disease, COPD, Budesonide-Formoterol is a highly effective combination of a corticosteroid and a long-acting bronchodilator. By reducing inflammation and relaxing the airway muscles, this medication acts as a formidable ally against respiratory conditions. Our in-depth exploration will shed light on the appropriate dosage and regimen, ensuring optimal results without compromising safety. Additionally, we will discuss potential side effects, drug interactions, and contraindications to maximize patient care and minimize risks. Whether you are a healthcare provider seeking to enhance patient outcomes or an individual eager to gain a clearer understanding of this medication, this video will equip you with the knowledge needed to unlock the full therapeutic potential of Budesonide-Formoterol. Join us as we embark on this enlightening journey into the world of respiratory health. Understanding Budesonide and Formoterol. Budesonide and Formoterol are both potent medications in their own right, but when combined, they offer a synergistic effect that can greatly benefit individuals with respiratory conditions. Budesonide is a corticosteroid that works by reducing inflammation in the airways, while Formoterol is a long-acting bronchodilator that helps relax the muscles surrounding the airways. When used together, these medications provide a comprehensive approach to managing respiratory symptoms. The combination of budesonide and formoterol is available in various formulations, including inhalers and nebulizers. The inhaler form allows for quick and targeted delivery of the medication directly into the lungs, while the nebulizer form is ideal for individuals who have difficulty using inhalers or require higher doses. It is important to note that Budesonide-Formoterol is not a rescue medication and should not be used to relieve sudden asthma attacks. Instead, it is intended for long-term management and prevention of symptoms. Uses of Budesonide-Formoterol in asthma management. Budesonide-Formoterol is primarily used in the management of asthma, a chronic respiratory condition characterized by airway inflammation and bronchospasm. It is indicated for both adults and children who require regular treatment for their asthma symptoms. This medication is particularly beneficial for individuals with moderate to severe persistent asthma, as it helps control symptoms and reduce the frequency of exacerbations. When used as a maintenance therapy, Budesonide-Formoterol can significantly improve lung function and reduce the need for rescue inhalers. It works by reducing airway inflammation and preventing the tightening of the muscles surrounding the airways, thus allowing for easier breathing. By following a prescribed treatment plan, individuals with asthma can experience a better quality of life with fewer symptoms and exacerbations. In addition to asthma management, Budesonide-Formoterol may also be used off-label for the treatment of chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease characterized by airflow limitation and persistent respiratory symptoms. While Budesonide-Formoterol is not specifically approved for COPD treatment, it can be prescribed by healthcare providers based on individual patient needs and response to therapy. Dosage and administration guidelines for Budesonide-Formoterol. The dosage and administration of Budesonide-Formoterol may vary depending on the age, severity of the condition, and individual response to treatment. It is crucial to follow the prescribed dosage and schedule provided by your healthcare provider to ensure optimal therapeutic outcomes. For adults and children 12 years of age and older, the recommended starting dose is usually 1 inhalation of Budesonide-Formoterol 0.25 micrograms, twice daily. The dose can be adjusted based on the individual's response, but should not exceed 2 inhalations twice daily. It is important to note that the maximum daily dose should not exceed 4 inhalations of Budesonide-Formoterol 0.25 micrograms. For children aged 6 to 11 years, the recommended starting dose is usually 1 inhalation of Budesonide-Formoterol 0.25 micrograms, twice daily. The dose can be adjusted based on the individual's response, but should not exceed 2 inhalations twice daily. The maximum daily dose for this age group is 2 inhalations of Budesonide-Formoterol 0.25 micrograms. It is essential to use the medication as directed, inhaling deeply and holding the breath for a few seconds to ensure the medication reaches the lungs. If using a nebulizer, follow the instructions provided by your healthcare provider or the manufacturer for proper administration. It is also important to rinse your mouth with water after each use to minimize the risk of oral thrush, a potential side effect of corticosteroid inhalers. Potential side effects and safety precautions. Like any medication, Budesonide-Formoterol can cause side effects, although not everyone will experience them. The most common side effects include headache, nausea, throat irritation, and cough. These side effects are usually mild and temporary, subsiding as the body adjusts to the medication. In some cases, Budesonide-Formoterol may cause more serious side effects, such as allergic reactions, increased heart rate, and changes in blood pressure. If you experience any unusual or severe symptoms after using Budesonide-Formoterol, it is important to seek medical attention immediately. To minimize the risk of side effects and ensure safe use, it is important to inform your healthcare provider about any existing medical conditions, allergies, or medications you are taking, including over-the-counter and herbal supplements. Budesonide-Formoterol may interact with certain medications, such as beta blockers and some antifungal medications, so it is crucial to disclose your complete medication history. In addition, Budesonide-Formoterol should be used with caution in individuals with certain medical conditions, such as heart disease, diabetes, and high blood pressure. It is important to discuss any pre-existing conditions with your healthcare provider to determine the appropriate course of treatment and dosage adjustments, if necessary. Interactions with other medications. Budesonide-Formoterol has the potential to interact with other medications, which can affect its effectiveness or increase the risk of side effects. It is important to inform your healthcare provider about all the medications you are taking, including prescription, over-the-counter, and herbal supplements. Some medications that may interact with Budesonide-Formoterol include beta blockers. Concurrent use of Budesonide-Formoterol with beta blockers can inhibit the bronchodilator effects of formoterol. It is important to discuss the use of beta blockers with your healthcare provider if you are prescribed Budesonide-Formoterol. Antifungal medications. Certain antifungal medications, such as ketoconazole and itraconazole, can increase the concentration of budesonide in the body, potentially leading to an increased risk of side effects. Your healthcare provider may need to adjust the dosage of Budesonide-Formoterol if you are taking antifungal medications. Other corticosteroids. Concurrent use of other corticosteroids, such as prednisone or methylprednisolone, with Budesonide-Formoterol may increase the risk of systemic corticosteroid side effects. It is important to discuss the use of other corticosteroids with your healthcare provider if you are prescribed Budesonide-Formoterol. Always consult your healthcare provider or pharmacist for a complete list of medications that may interact with Budesonide-Formoterol to ensure safe and effective use. Comparing Budesonide-Formoterol with other asthma medications. When it comes to managing asthma, there are various medications available, each with its own unique benefits and considerations. Budesonide-Formoterol is a combination medication that offers the advantages of both a corticosteroid and a long-acting bronchodilator. Let's compare Budesonide-Formoterol with other commonly used asthma medications. Short-acting bronchodilators. Short-acting bronchodilators, such as albuterol, provide quick relief of asthma symptoms by relaxing the airway muscles. However, they do not have the anti-inflammatory properties of corticosteroids and are not intended for long-term management. Budesonide-Formoterol, on the other hand, offers both short-term relief and long-term control of symptoms. Inhaled corticosteroids. Inhaled corticosteroids, such as fluticasone and beclomethasone, are commonly used for the long-term management of asthma. They work by reducing airway inflammation and are highly effective in preventing asthma symptoms and exacerbations. However, they do not provide immediate relief of symptoms. Budesonide-Formoterol combines the benefits of an inhaled corticosteroid with a long-acting bronchodilator, offering both long-term control and quick relief of symptoms. Long-acting bronchodilators. Long-acting bronchodilators, such as salmeterol, provide sustained bronchodilation and are often used in combination with inhaled corticosteroids for individuals with moderate to severe persistent asthma. However, they do not have anti-inflammatory properties and are not recommended as monotherapy for asthma management. Budesonide-Formoterol combines the benefits of a long-acting bronchodilator with a corticosteroid, providing a comprehensive approach to asthma management. Ultimately, the choice of medication depends on the individual's specific needs and response to treatment. It is important to work closely with your healthcare provider to determine the most appropriate medication and treatment plan for your asthma management. FAQs about Budesonide-Formoterol. Can Budesonide-Formoterol be used as a rescue medication for asthma attacks? No, Budesonide-Formoterol is not intended as a rescue medication for sudden asthma attacks. It is a maintenance therapy designed for long-term management and prevention of symptoms. If you experience an asthma attack, you should use a short-acting bronchodilator as directed by your healthcare provider. Can Budesonide-Formoterol be used during pregnancy? The use of Budesonide-Formoterol during pregnancy should be discussed with a healthcare provider. While it is generally considered safe, the potential benefits and risks should be carefully weighed. Your healthcare provider can provide personalized guidance based on your specific situation. Can Budesonide-Formoterol be used in children? Budesonide-Formoterol is approved for use in children aged 6 years and older for the treatment of asthma. The dosage and administration guidelines may vary based on the child's age and individual response to treatment. It is important to follow the prescribed dosage and schedule provided by your healthcare provider. Can Budesonide-Formoterol be used in COPD? While Budesonide-Formoterol is not specifically approved for COPD treatment, it may be prescribed off-label by healthcare providers based on individual patient needs and response to therapy. It is important to consult with your healthcare provider to determine the most appropriate treatment options for COPD management. Tips for proper inhaler technique. Using an inhaler properly is crucial to ensure the medication reaches the lungs and provides optimal therapeutic effects. Here are some tips for proper inhaler technique when using Budesonide-Formoterol. Shake the inhaler well before each use to ensure proper mixing of the medication. Remove the inhaler cap and hold the inhaler upright, with the mouthpiece facing away from you. Exhale fully, away from the inhaler. Place the mouthpiece between your teeth and close your lips around it, creating a seal. Do not bite the mouthpiece. Inhale deeply and forcefully through your mouth, pressing down on the canister to release the medication. This should be done in one smooth motion. Hold your breath for a few seconds to allow the medication to reach the lungs. Exhale slowly and away from the inhaler. If a second dose is prescribed, wait for the specified time interval before repeating the steps. After each use, rinse your mouth with water and spit to minimize the risk of oral thrush. It is important to practice proper inhaler technique and consult your healthcare provider or pharmacist if you have any questions or concerns. Conclusion: the potential benefits of Budesonide-Formoterol in asthma treatment. Budesonide-Formoterol is a powerful combination medication that offers a comprehensive approach to managing respiratory conditions such as asthma. By combining the anti-inflammatory properties of budesonide with the bronchodilator effects of formoterol, this medication provides both long-term control and quick relief of symptoms. When used as directed, Budesonide-Formoterol can significantly improve lung function, reduce the frequency of exacerbations, and enhance the overall quality of life for individuals with asthma. It is important to follow the prescribed dosage and administration guidelines, while also being mindful of potential side effects and drug interactions. Whether you are a healthcare provider seeking to optimize patient outcomes or an individual looking to gain a better understanding of this medication, the knowledge gained from this comprehensive guide will help unlock the full therapeutic potential of Budesonide-Formoterol. By harnessing the power of this innovative treatment, we can pave the way for better respiratory health and improved well-being. Thanks for watching.